Welcome to the Omnidental Podcast.
Great to be here.
Today we're doing a deep dive into something super relevant to everyone, your oral health. Specifically, we're looking at those signals, the kind of crucial signs you need to see a dentist sooner. This is all about getting you well-informed quickly about what your mouth might be, trying to tell you.
Exactly. And it's funny how often we just sort of ignore those little signals, right? Or just brush them off. So today, we want to decode some of those signs, give you the knowledge to spot when it's really time to get professional care. Doing that can honestly prevent much bigger issues down the road.
We've pulled together insights from some specialized sources that really map these signs out. And speaking of professional care, we should also quickly mention Omnidental. They're a trusted family practice.
Right, located in Arlington Heights, Illinois, 305E Rand Road. Dr. Beezus Poles leads the practice, and he has, well, over 10 years of experience, general, cosmetic, preventive dentistry, the whole range.
Yeah, and they really focus on the patient. Personalized plans, comfortable setting, advanced tech, good stuff. So whether you're thinking about a checkup, just want to know more, or you're curious, this deep dive is for you.
And they serve quite a few areas around Arlington Heights, too. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Elk Grove Village, a wide reach. But, okay, let's get into those warning signs.
Okay, let's unpack this. So the first big one our sources flagged is persistent tooth pain. We're not talking about like a quick sensitivity thing, but pain that sticks around or feels sharp.
Yeah, that's a really important distinction. Persistent pain. Why is that so critical?
Well, because it can signal some serious underlying stuff.
Yeah.
Tooth decay that's gone deep, maybe a damaged filling, or even an infection starting in the tooth.
So not just an annoyance.
Definitely not. If the pain kind of comes and goes or gets worse when you bite down or chew, that's your mouth basically yelling for attention,
Right.
putting it off. That could easily lead to a real dental emergency. Okay, here's one I think almost everyone has felt. Sensitivity to hot or cold.
That sudden jolt, right, from coffee or ice cream. It's easy to just think, oh, I'll avoid that.
Right. But our sources stress it's more than just an inconvenience. That jolt can actually mean your enamel, the hard outer layer, is wearing thin. Or maybe your gums have receded a bit, exposing the root.
Ah, so the protection is weakened.
Exactly. And if you connect that to the bigger picture, if you just let that sensitivity go, it can get worse. And potentially, down the line, it could even contribute to tooth loss. It's your mouth saying, hey, the defenses are down.
And then, okay, bleeding or swollen gums. I think a lot of people, myself included sometimes, kind of brush this off, maybe think, oh, I flossed too hard. Pun intended, I guess. But the sources say no, right?
Yeah, absolutely. This is a big one. Gums that bleed easily when you brush or floss or look puffy and red, that's often the very first sign of gum disease. Gingivitis, usually.
So healthy gums shouldn't bleed at all? Pretty much no. Healthy gums are resilient. Bleeding is a sign of inflammation, usually caused by plaque buildup. The good news here, though, is that if you catch it early, gum problems are way easier to treat. You can often reverse gingivitis with good hygiene and professional cleaning. So acting timely is key.
Okay, moving beyond the teeth and gums themselves, our sources point to other mouth symptoms. And one that might surprise people is persistent bad breath, like chronic halitosis.
Yeah, it's interesting because people think of it mostly as, a social thing, embarrassing.
Hmm.
But chronic bad breath is very often a sign that something else is going on. Could be tooth decay you don't see, maybe an infection hiding somewhere, or just generally poor oral hygiene letting bacteria build up. It's definitely a symptom, not just, bad luck after lunch.
That makes sense. Another one they highlight is sores in the mouth that just don't heal. We all get little canker sores or bite our cheeks sometimes, right? They usually go away fast.
Right, most do. But the key here is how long they stick around. If you have any kind of sore or an ulcer, maybe on your tongue or cheek, and it's still there after 2 weeks, that's the point where you absolutely need to get it checked by a dentist.
2 weeks. Okay.
Yeah, it could be an infection or, and this is why it's important, it could potentially be something more serious. It raises that question. Are you actually paying attention to how long things take to heal in your mouth? Don't ignore a sore that lingers.
Okay, that definitely leads us into the more urgent stuff, the things that scream, get help now. And the sources are really clear here. Facial swelling or suddenly losing a tooth. These are emergencies.
Oh, absolutely. No question. These are critical. You need immediate treatment. Facial swelling, especially if it's around your jaw, could mean a bad infection, like an abscess, is spreading. That's serious.
Oh, wait on that.
No way. And losing a tooth suddenly, maybe from an accident or even an infection, time is critical there too. If a tooth gets knocked out, getting to a dentist, ideally within an hour, gives the best chance of saving it.
Wow, an hour. Okay.
Yeah, it's fast. And OmniDental, they actually offer emergency dentist services for exactly these kinds of situations. They know speed matters.
Good to know. And the last big one, pain that actually messes with your life, like pain that keeps you up at night, makes it hard to eat, hard to focus. Our sources say that's a major red flag.
It really is. That level of pain should never, ever be ignored or just toughed out. It means the problem has gone way beyond a minor issue. It's your body basically screaming for help.
There's even a rule for it, right?
Yeah, the sources mention the 3-3-3 rule for toothache, which is pretty handy. If your pain lasts more than 3 days,
Okay.
or you'd rate it higher than a 3 out of 10 on a pain scale,
Right.
or if it actually gets worse over 3 days, then it's definitely time to call the dentist. And obviously, any really severe pain, swelling, bleeding you can't stop, or a knocked out tooth that's emergency dentist territory straight away.
Got it.
Yeah.
So with all these potential problems, what's the best way to prevent ending up in an emergency situation? Our sources circle back to some core basics, right? Like good daily hygiene.
Absolutely foundational. Brushing twice a day, making sure you do it for 2 minutes, using fluoride toothpaste, and flossing every single day. That's your #1 defense. It removes the food bits and the bacteria, the plaque, that causes almost all the problems decay, gum disease.
Seems simple, but easy to slack on.
It is, but consistency is everything. It really works.
And the other big one, even if nothing hurts, don't skip your regular dental checkups.
Yes. This is so important. Your dentist can see things you can't. Tiny cavities starting, early signs of gum issues, even check for things like oral cancer. Catching stuff early makes treatment much, much simpler.
And less expensive, usually.
Usually, yes. And those professional cleanings get rid of tartar that you just can't remove at home. It links back to practices like OmniDental again. They offer all that comprehensive stuff: preventive care, cleanings, general dentistry. Plus, they have advanced treatments if needed, using modern tech for diagnosis and care. Dr. Poles also handles injuries and emergencies. It's that whole patient-focused approach, treating everyone like family, from kids to older adults. It's about that long-term health partnership.
So it really boils down to being proactive.
Right.
Understanding the signs your body gives you, and then using the expert help that's available.
That's it in a nutshell. Your mouth is constantly sending signals. The real question is, are you listening? The things we talked about, pain that lingers, bleeding gums, sores hanging around, really bad pain, don't ignore them. They're messages.
And seeing your dentist when you get those messages, that protects your smile, prevents worse pain, and honestly, it protects your overall health too. So don't wait. Just being aware of these signs is a huge first step for your well-being.
Which leads to maybe a final thought for you, the listener, to consider. How might recognizing these subtle signals from your mouth actually empower you to be more observant about other health indicators from your body? Could this help you take a more proactive, maybe a more holistic role in your overall health journey? Something to think about.
Absolutely. To learn more, or if you want to schedule an appointment with a practice that really emphasizes that patient-first care, you can contact OmniDental. They're in Arlington Heights, Illinois. The number is 847-483-8833, or you can find them online. They really look forward to welcoming you to their dental family.